Hello dear students, welcome back. So in this class we'll be doing a rapid revision of the chapter of nutrition, okay? Alright, so first of all, it's been divided into different parts, like we'll be starting with reference man, woman, all the essential micronutrients, vitamins, food adulteration, and towards the end the programs as well as the food logos, okay? So first thing that I've discussed in the main lecture also, who's a reference man and a reference woman. So recommended dietary allowance is always, set for a reference man and a reference woman, and accordingly it is given. So just look at this, the guidelines for reference man and reference woman is very, very important. These are all the updated guidelines, and this is updated. These updated guidelines are based on what? National Institute of Nutrition, okay? This question can definitely come, National Institute of Nutrition. And where is the headquarters of National Institute of Nutrition? So we all know that is in Hyderabad, okay? So that is it, okay? So who's a reference man? Indian reference man age and Indian reference woman age is the same, 19 to 39, okay? The weight of Indian reference man 65 kg and the weight of Indian reference woman 55 kg. And this BMI that you see over here, 18.5 to 22.9, this is according to the Asian classification or according to the Indian classification, because we all know according to WHO classification normal BMI is 18.5 to 24.9, okay? So this you have to remember. Plus, you please don't ignore this activity level, reference man and woman, 8 hours of sleep, 8 hours of moderate work, 4 to 6 hours of sitting, moving, and 2 hours of walking recreation. This is very, very important. That is why I've kept it in the first slide only, okay? Then what about the energy requirements? These are also based on reference man and woman only. So how have I made you learn it? Now, here, what had we done in the main lectures also, like sedentary, moderate, and heavy worker, male and female. Now, if you can see, whatever is the energy requirement by the adult male, okay, sedentary adult male, you can write this as 2100, moderate is 2700. The same is the energy requirement by a moderate and heavy worker female, okay? Here ho gaya 2100 and here 2700. Plus here it was 1660 for a sedentary worker woman, so you can do it as 1700 and just double it everybody. So you can do, remember, heavy worker male is 3400, okay, 3400. So that's how you can remember it. Whatever is the energy requirement by sedentary and moderate worker male, 2100, 2700, that's the same by moderate and heavy worker female, 2100, 2700, and by adult woman it is 1700. You will just multiply that, usko double kar do, so by heavy worker 3400, okay? That's how you're going to remember it. Now, in pregnancy, guys, plus 350, this has to be added to whatever is the energy requirement by a sedentary worker female, which is 1660 or roughly 1700. So on that you have to add plus 350. Now, remember one thing, lactation first 6 months. So you say first 6 months, so plus 600. First 6 months plus 600. 7 to 12 months plus 520. No change in pregnancy and lactation from previous guidelines, okay? This means from previous guidelines. These are all according to NIN updated guidelines, okay? These are all according to what? NIN updated guidelines, guys. Okay, here I would like to tell you something, okay? In pregnancy, please remember, if suppose this has not been mentioned, okay, according to NIN or something, technically in the first trimester, okay, no additional calorie required, okay? No additional calorie is needed in the first trimester, okay? In the second trimester, everybody, how much is the additional calorie? Plus 350 kilocalories per day, okay? And in the third trimester, everybody, if they ask you separately, plus 450 kilocalories per day. This is like a high yield point which I am giving you out, okay? Alright. What about the protein requirement per day? 0.83 gram per kg per day. This was earlier 1 gram per kg per day. Okay, now this is only for your revision, vitamins and minerals requirement. Like I've told you in the main lecture also, you could be asked which requirements are increased in pregnancy and lactation. But here we'll just quickly look at this chart. You all know weight 65, 55. In pregnancy, how much is the weight gain? Roughly 9 to 11 kgs, so 10 kgs. But if a woman belongs to low socioeconomic status, it is roughly around 6 kg. Then these are the proteins. More important than that is if you look at which requirements are increased during lactation. Okay, so during lactation, please remember two things which are very, very important. Calcium, you always read calcium and vitamin A. Their requirement is increased. See, 1200 and 950. Even if you forget the values, remember the requirement is increased. And iodine. Iodine values have to be remembered. Males 150 microgram per day, females also 150. Pregnancy mein how much is iodine? 250 microgram per day, and in lactation 280. Okay, so here see, nutrients requirement which is increased during lactation is calcium, okay, vitamin A and iodine. Okay, this I wanted you to remember. All right, and vitamin D, something which remains the same. Read calcium and vitamin D together, so 600, 600, 600, 600. Okay, international unit. Now what about pregnancy? So we all know in pregnancy a woman needs to take iron, folic acid. So iron and folic acid requirement, okay, are increased during pregnancy. Okay, so here you can see iron may 40 milligram per day and folate 570 microgram per day. Plus, जो prophylactic iron folic acid that we are giving under Anemia Mukt Bharat consists of 60 milligram elemental iron and 500 microgram of folic acid. So please go through this chart. More importantly are the values of the nutrients whose requirements are increased during pregnancy and whose requirements are increased during lactation. Okay? So that was one very, very important part. What about for an infant? Sometimes it can come. So 0 to 6 months energy requirement is 92 kilocalories per kg per day. Protein is 1.16 grams per kg per day. 6 to 12 months 80 kilocalories per kg per day and 1.69 grams per kg per day. More important than infants or something is the energy requirement in pregnancy, lactation. Okay, now let us come to nutrients. You know there are two types of nutrients as we have done in the main lectures also. Macronutrients, micronutrients. Macronutrients are what? The proximal principles. Okay, they form the main bulk of our food. So what are they? Protein, fats and carbohydrates. So proteins have to provide 10 to 15% of daily energy intake. Fats have to provide 15 to 30% of daily energy intake, and carbohydrates 50 to 80%. And if this percentage is being fulfilled, everybody, where proteins provide 10 to 15% of daily energy intake, fats provide 15 to 30% and carbohydrates 50 to 80%, this is also what is known as balanced diet. Okay, all this has been discussed in detail in main lectures. All right, now what are micronutrients? They are required in small amounts from a fraction of milligram to several grams. Okay, from few milligrams to several grams. Those are micronutrients. But they also ask you to further classify. So remember, they consist of vitamins and minerals. In minerals, this is a very famous PYQ. They've gone one step ahead in asking. Minerals may you have major minerals. Okay, what are the major minerals? And you also have something known as trace elements. So major minerals are, please remember, read calcium, phosphorus together, sodium, potassium together, and magnesium. Now important thing is iron, iodine, okay, fluorine, which we study so much. Okay, iron, iodine, fluorine, okay, which we study so much. Iron deficiency, anemia, iodine requirements, goiter, all those things. These are what? Trace elements. They are required in quantities less than a few milligrams per day. Okay, trace. See, micronutrients, few milligrams to several grams. In that also you have major minerals which are required in slightly more numbers, but trace elements are less than a few milligrams. And remember the trace elements, more important for your exam, iron, iodine, fluorine. They are also this time asking zinc and chromium deficiency, cobalt, C's, 3 C's, cobalt, copper and chromium. Okay, manganese, molybdenum, selenium, silicon, nickel and tin. Trace contaminants with no known function like lead, mercury, barium, boron as well as aluminium. But what is more important? Macronutrients, proteins, carbohydrates, fats, how much energy they are providing, okay, what percentage they make up of our diet. Then micronutrients, vitamins and minerals. Minerals may name the major minerals and name the trace elements. Okay, all right. Now energy providing food products, these are all PYQs, so you need to revise it as high yielding point and rapid revision. Carbohydrates provide us 4 kilocalorie per gram of carbohydrates. Proteins provide us 4 kilocalorie per gram. Fats provide 9 kilocalories per gram of fats. Other foods, this has also been asked, okay, fibers. So per gram of fibers, it gives you 2 kilocalories, and per gram of alcohol was also asked 7 kilocalories once, okay. Now let us quickly talk about some important points from proteins which come as questions. So proteins, you all know, are made up of amino acids. And in amino acids, the important one is name the essential amino acids. Now, what are essential amino acids? Those amino acids which cannot be synthesized in the body. They cannot be. So, they have to be provided in our diet from outside. Like, they have to be obtained in the diet. Okay. And there are 9 essential amino acids. You can revise this from the mnemonic PVT Tim Hall. Okay, so P stands for what? Phenylalanine, everybody. V stands for valine. T stands for tryptophan. Okay, there is another T. All right, that stands for threonine. All right, then there is I, isoleucine. Okay, isoleucine. Then we have M, methionine. All right, PVT Tim Hall. Okay, then H stands for, you can remember, histidine. All right, there is no A, but HA you can write LL, leucine and lysine. Okay, leucine and lysine, these are important. So rest, the other ones, non-essential amino acids, non-essentials are synthesized in body. More important is to remember essential. There's something known as semi-essential amino acids. Now semi-essential amino acids example are arginine and histidine, guys. Okay, arginine and histidine. Now what are these semi-essential amino acids? These semi-essential amino acids are amino acids whose requirement is increased during vulnerable times. Okay, requirement increased during which time? The requirement is increased. All right, the requirement is increased during vulnerable period. Okay, what do you mean by vulnerable period? Like maybe in adolescent, okay, or during pregnancy, lactation, the requirement is increased. Okay, so that is what is semi-essential. All right, arginine and histidine. Okay, another PYQ, supplementary action of proteins. If I ask you, why do we eat dal and chawal together? Why do we eat dal and chawal, or in other words, cereals and pulses together? Why do we eat them together? Of course, they appear to be tasty, but what is the scientific reason? See, cereals and pulses, you know, they are the staple diet. Okay, maximum majority people in India are eating this dal and chawal thing. Okay, so they form the staple diet of people. Okay, now what happens? The cereals, if you talk about, they are deficient in which amino acid? Threonine and lysine. How had we learnt it? CTL. Okay, it's deficient in threonine and lysine. Pulses may, more important, you have to remember PM, Prime Minister. Pulses, methionine and cysteine. So PMC, maize, tryptophan and lysine. Now, if you eat dal and chawal together, so threonine and lysine is the limiting amino acid in chawal or cereals. Okay, all right, that you're going to get by eating chawal or cereals with pulses. Okay, so when you eat dal and chawal or cereals and pulses together, all right, whatever is the limiting amino acid in one food product is supplemented from the other food product. Okay, that is known as supplementary action of protein. Now sources, I just want you to know, one, you can have animal and plant sources, but what is MCQ is that which are biologically complete protein. Okay, are they the ones that are animal source proteins or vegetable source? So please remember, animal sources are biologically complete protein because they contain all essential amino acids in adequate amounts, and we all know that egg has been taken as the reference protein. Abhi we'll be seeing egg also. Why? Because it contains all essential amino acids. Okay, it contains what? All essential amino acids. Okay, and vegetables are poor in essential amino acids. India, see, cereals and pulses form main sources of dietary protein because they are cheap, easily available, consumed in bulk. So basically cereals and pulses are the staple diet in India. Okay, what are they? They are the staple diet in India. Okay, all right, that was important. Now next important thing from protein is the indicators of protein quality. So we have a DIA score, PDCAS score, NPU score. NPU, as we have studied, biological value into digestibility coefficient by 100. Okay, but most important, just this, if you want to learn in detail, you can refer to the main lectures, but the best indicator for protein quality, guys, diascore. Okay, all right. Now net protein utilization of Indian diet is 50 to 80. 1 gram of protein is equivalent to 6.25 grams of nitrogen. This is a PYQ. All right. Eggs are called as reference protein because they have the maximum net protein utilization 96, which is like almost similar to 100. Okay, and then eggs क्या contain करते हैं? So I've taught you this before also. You can remember the rule of 6. That means an average hen's egg weighs how much? An average hen's egg weighs 60 grams. Okay, it's providing you how much? 60 gram fat. Okay, 6 gram protein and 60 to 70 kilocalorie. You can remember 60 to 70 kilocalorie energy. Okay, so this could be 60 to 70 plus 30 milligram calcium, 1.5 milligram iron, and this has the maximum cholesterol, 250 milligram maximum cholesterol. Okay, this is asked about egg. All right, now see, best quality protein is in egg. Okay, best quality protein. Where do you find the best quality protein? Best quality protein is in egg. But which food product has the maximum amount of protein or the maximum quantity? So highest quantity is present in soya bean. Okay, that is 43% protein, giving 432 kilocalorie energy per 100 grams. Okay, so maximum quantity of protein is in soya bean, but the best quality of protein is in eggs. Okay. All right. Okay, so that was the golden point about protein. Now, what about fats? Fats are the richest sources of energy. All right. They provide us 9 kilocalorie per gram of fat is the energy provided. They include simple lipids, compound lipids and derived lipids. Okay, the fats are further classified. Simple, compound, derived, more important for biochemistry, but from public health point of view, you have to divide it into saturated and unsaturated fatty acids. Saturated is lauric, palmitic and stearic, and unsaturated fatty acid, guys, we have monounsaturated, which is oleic acid, and polyunsaturated fatty acid. So polyunsaturated fatty acids, you have omega-3 as well as omega-6. Okay, omega-6 is linoleic and omega-3 is linolenic acid. Okay, that is important. Source of fat is very important. Okay, which is the most essential fatty acids? Please remember, most essential fatty acid is a question. Okay, that is linoleic acid. Okay, and it gives us also arachidonic acid, and the richest source of that, okay, the richest source of that is safflower oil. Okay, linolenic ka richest source is flaxseed oil. Eicosapentaenoic acid is derived from that only, so that is fish oil. Okay, so this is very, very important. Most essential fatty acid kya hai and what is the richest source of it. Okay, now look at this. I've just put out some high yield point over here. Okay, so essential fatty acids, linoleic, arachidonic acid. Okay, these are all what? Polyunsaturated fatty acids. Okay, so maximum is in safflower oil. Okay, monounsaturated fatty acids, here you had studied oleic acid. Okay, so monounsaturated, more is in olive oil. Saturated fatty acids are coconut oil and butter. Okay, and saturated fatty acid, we all know, is not good for health. Okay, so that is again a golden point. Linolenic, I've told you, is flaxseed oil. You have to know this. What is the richest source of linoleic acid? It is safflower oil. Linolenic acid, it is flaxseed oil. They are good ones. Okay, and saturated, which is bad, is coconut oil and butter. Eicosapentaenoic acid is derived from fish oils. Okay, iron ka richest source is dried pumpkin seeds, then pistachio and cashew. Okay, green leafy vegetables. Golden rice, genetically modified crop, which is fortified with two things: vitamin A and iron. Vitamin D richest source is halibut fish liver oil. This we'll do separately also. And vitamin A from any fruits do you get? Yes, ripe fruits like mango, yellow fruits basically, mango and papaya. Vitamin A in vegetables, in carrots. Okay, vitamin C, amla is the richest source. Okay, all right. Now, let's quickly have a look at some of the vitamin deficiencies. Also, you all know vitamin A deficiency is xerophthalmia, which refers to all ocular manifestations. Okay, most common in the age group 1 to 3 years. Now, important is the WHO classification. Okay, so how do you classify this? You classify this in the form of primary signs, everybody, and we also classify this in the form of secondary signs, right? So, what is primary signs? X1A, which is conjunctival xerosis. Then we have X1B, B for Bitot spot. Okay, and then we have X2. All right, This is what? Corneal xerosis. Then we have what? X3A and X3B. So what is X3A, guys? Corneal ulcer, okay, but it includes less than 1/3 of surface of cornea, 1/3 of surface of cornea, okay, and X3B is what? Corneal ulcer. Then you have XF. XF is xerophthalmic fundal changes. Okay, this is fundal changes, and XS, everybody, is scarring. Okay, so this is very, very important WHO classification. They ask you, is Bitot spot reversible? Is Bitot spot reversible in vitamin A deficiency? So the answer to this is yes, Bitot spot is reversible. So remember, till X3A, it is reversible. Okay, now here you can see two very important things. This is conjunctival xerosis, okay, X1A, and this one over here is the Bitot spot. Okay, this will also be discussed in image sessions. This is formed on bulbar conjunctiva, palpebral side of bulbar conjunctiva. So most common presenting symptom in, these are key points for vitamin A deficiency, okay, which can come in your exam. So most common presenting symptom, everybody, is night blindness. Okay, then what is the most common presenting manifestation? Again, this is night blindness. What is the first symptom? This is also night blindness. Most common indicator for vitamin A deficiency, most common indicator is Bitot spot. First clinical sign is something that the doctor notes, that is conjunctival xerosis. Most specific is what? Bitot spot. Okay, it is reversible till which stage? So remember, X3A. Irreversible stage is X3B. Okay, most common symptom that a person will present is night blindness. He cannot see at night. But the most common, the first clinical sign which a doctor is going to appreciate is conjunctival xerosis, and most specific is Bitot spot. Okay, now look at this. We all know that we need to classify whether vitamin A deficiency is a public health problem or not. So in which age group are we looking for the prevalence criteria? In which age group? This is, please remember, 6 months to 6 years. Okay, so in this age group of 6 months to 6 years, we are looking at prevalence of these particular criteria to determine whether vitamin A deficiency is a public health problem or not. Now we know night blindness is the most common symptom, so it has to be present at least in more than 1%. Age group 6 months to 6 years. Bitot spot more specific, so more than 0.5%. These are most repeated PYQs. Okay, then corneal xerosis, ulceration, keratomalacia, more than 0.01%. Okay, corneal ulcer as well as scar, more than 0.05%, and serum retinol less than 10 mcg per dl, more than 5%. ठीक है, remember the two things. Bitot spot का कितना prevalence होना चाहिए? 0.5, and night blindness more than 1%. Which age group? 6 months to 6 years. Okay, now nutritional deficiency, this is just a summing up chart, guys. Like you all know, vitamin A we have done. What about vitamin B1? So B1 is what? B1 is basically thiamine deficiency. Okay, so where do you notice thiamine deficiency? So in thiamine deficiency, what happens? Beriberi. Okay, beriberi is very important. This is noticed among polished rice eaters. Okay, basically in Andhra Pradesh, Telangana, those sites. Okay, beriberi. Now remember, beriberi is of two types. Okay, wet beriberi, which has severe symptoms, and dry beriberi, which has neurological symptoms. So which one is more serious? The wet beriberi. Plus in chronic alcoholics also we see thiamine deficiency, which manifests as Wernicke-Korsakoff psychosis. B2, I'll show you the image for B2. B2 is riboflavin. So ye riboflavinosis triad. In this, what are the three things that happen? Cheilosis, okay, angular stomatitis, and everybody geographic tongue, or you could also say glossitis. Okay, we'll see the picture. Vitamin B3, niacin deficiency. You all know tryptophan is converted into niacin, so I'll revise this with the help of picture. All right, B6, pyridoxine deficiency. These are all PYQs which I have written it over here. ठीक है, B6 is pyridoxine deficiency leading to microcytic anemia and peripheral neuropathy. And where do you see pyridoxine deficiency? People who are taking isoniazid, the anti-TB drug. All right, that is very, very important. Then B9. B9 is folic acid deficiency of which leads to megaloblastic anemia and NTD. Yes, women who are planning to conceive, they should take 400 microgram of folic acid every day. Okay. Vitamin B12 deficiency is cyanocobalamin, peripheral neuritis, megaloblastic pernicious anemia. This is important. SACD. What is this SACD? SACD was an MCQ, subacute combined, okay, subacute combined degeneration of what? Spinal cord. So SACD is noticed in whom? Vitamin B12 deficiency. Vitamin C, you know, scurvy, swollen gums. Richest source of vitamin C is amla. We have already discussed. And scurvy pe kisne kaam kiya tha, if you remember in the main video? From the main video, James Lind. Okay. Vitamin C, you know, this is also a PYQ. This is required for synthesis of what? Collagen, right? Synthesis of collagen. And you know, collagen is like a supporting framework for blood vessels also, all right, bones also, all those things. So if vitamin C is deficient, collagen is deficient. So this leads to what? Fractures in bones, delayed wound healing and gum bleeding. Please don't say infertility. That's not associated with vitamin C. Okay. All right. Vitamin D deficiency, rickets in children. You remember bow leg. Yes. Genu varus. Okay. All right. That is important. Osteomalacia, osteoporosis in adults. Vitamin E, progressive external ophthalmoplegia. Okay. Which vitamin deficiency is going to occur definitely among vegetarians? So I'll write it over here. Vitamin B12 deficiency seen among vegetarians. Okay. Vitamin B12 deficiency is definitely going to occur among vegetarians. Okay. So that's seen among vegetarians. Got it? Now look at this. That was a summary slide. So you can just go through that slide at the end. Okay. These are certain pictures I wanted to revise. So you know this is vitamin B2 deficiency. Okay, this is A riboflavinosis triad. Okay, so here chelosis. All right, chelosis, fissures on the side of the mouth. This is angular stomatitis. Okay, angular stomatitis, and plus यहाँ पे क्या होता है? Geographic tongue. All right, this is what? Geographic tongue. Geographic tongue, glossitis. And what is the color of the tongue? This is magenta red tongue. Okay, magenta red tongue. All right. Where do you see beefy tongue? If they ask you, that was magenta red tongue. Okay. Where do you see beefy tongue? I'll write it here. In vitamin B12 deficiency, what presents? It presents with a beefy tongue. And if you remember, strawberry-like tongue was in scarlet fever. Okay. What is this? Very, very, very important. Now here the person suffers from which deficiency? Everybody. So the person is suffering from niacin deficiency. All right. Now what happens? See, tryptophan, all right, tryptophan gets converted to niacin, all right, and 60 milligram tryptophan gives 1 milligram of niacin. So now deficiency of niacin leads to what is known as pellagra, guys. Okay, pellagra. In pellagra, it presents with diarrhea, dermatitis. Can you see this? Bilateral dermatitis over sun exposed area. All right, here also dermatitis. Okay, diarrhea, dermatitis, delirium, depression. Okay, diarrhea, dermatitis, delirium, depression, dementia, very, very important, and death. Okay, so almost 6 Ds. Okay, plus isko kya bolte hain? What is this? Castle's necklace. Okay, now where do you see, in whom do you see this? This is very common question among maize eaters, or you could also say jawar sorghum eaters. Okay, so in them, do you have deficiency of tryptophan? No, in maize eaters, jawar sorghum, tryptophan is present, but there is something which is known as excess of leucin. Okay, this excess of leucin does what? It prevents conversion of excess of leucin prevents conversion of tryptophan into niacin. Okay, there's excess of leucin which prevents conversion of tryptophan into niacin. Okay, now what is this? Now look at the teeth as well as the gums. This is vitamin C deficiency. All right, already discussed, and this presents with what is known as scurvy. Okay, now another question which is a PYQ. Essential fatty acid deficiency leads to phrinoderma or toad-like skin. Zinc की inherited deficiency will lead to acrodermatitis enteropathica, which is inflammatory rashes around the mouth. You know, this is important. Mouth के around हो जाता है, anal region के around हो जाता है, ठीक है? So these are certain things. Chromium also leads to impaired glucose tolerance. Okay? So that was about the vitamins and some important nutritional deficiency. Now, if you talk about iron among the micronutrients, okay, among the micronutrients, we are going to talk about irons, okay, because certain questions do turn up. This is a trace element. Now, this I have put diagnosis of anemia ke liye. In adult male, hemoglobin below 13 is anemia. Female non-pregnant 12, adult female pregnant 11 gram per dl से नीचे अगर hemoglobin होगा, below that it's going to lead to, it will be called as anemia. Okay, children 6 months to 6 years 11, 6 to 14 years 12. All right, so that is very, very important classification. Now, something which is important over here, which comes as an indicator, how will you evaluate iron deficiency? Okay, so hemoglobin concentration is an epidemiological indicator of anemia. Epidemiological indicator of anemia, if you have to take, we have to take hemoglobin concentration, okay? But nutrient depletion, this is insensitive indicator. So, best index of nutrient depletion. Okay, in that we see serum iron concentration. And this question is a PYQ. Which is the most sensitive tool for evaluating iron status, guys? Serum ferritin. Okay, so epidemiological indicator for evaluating iron, that is hemoglobin. Nutrient depletion के लिए serum iron concentration. But most sensitive tool for evaluating iron status is serum. Another trace element which is asked is fluorine. Now, can you look at these two images? Yes. Now, you know that fluorine is known as a double-edged sword. Why? Because excess of fluorine is also a problem and less of fluorine also. Remember the normal fluoride level, okay, normal fluoride level in drinking water, everybody. How much is it? Normal fluoride level in drinking water. So we know it is 0.5 to 0.8 milligram per liter. Okay. Now, if there is less than 0.5, okay, this is what is happening. Dental caries. Okay. But if the fluoride level is more than 1.5 milligram per liter, this happens. So here you will see mottling of the upper incisors of the teeth. This is known as dental fluorosis. Please don't say it is occurring at levels more than 0.8. No. Dental fluorosis is mottling of incisors of the upper teeth, which is occurring at levels of fluorine in water more than 1.5 milligram per liter. Okay. Then it also leads with excess of fluorine can also present with, so basically it's presenting with three things. Okay. One is dental fluorosis, which is accompanied by mottling of the upper incisors of the teeth. Okay. Then there is something known as skeletal fluorosis, which we have studied in the main videos as well. And there is something known as crippling fluorosis. Okay. What is it? Crippling fluorosis. Now, dental fluorosis, the level is more than 1.5 milligram per liter in drinking water. Skeletal fluorosis, everybody, 3 to 6 milligram, and crippling is more than 10 milligram per liter of drinking water. Fluorine. Now, this was presenting as which presentation? If you remember, is it this or is it this? Not Bolex. That was this. ये क्या था? What was this known as? This is known as Jenu valgum. By gum, it appears as if by gums the two knees have stuck. So this was also known as what? Knock-knee syndrome. Okay, it means like by gum, glue say both the knees have come together. So this was also known as knock-knee. See, this is Jenu valgum, everybody. Okay, this is knock-knee. Jenu say gum say knees have come together. That is crippling fluorosis. Okay, all right. So that was about macronutrient, micronutrient, vitamin, minerals, all the essential points I have summed up for you along with some deficiencies. Now, food adulteration, guys, is one of the most expected topics. So we'll be looking at quickly at some points from food adulteration, nutritional health programs, and food logos. Okay. Now, food adulteration is like, what are the food in which you're asked? Khesari dal. Okay. All right. Khesari dal is Lathyrus sativus. Okay. This is similar to arhar dal. So what happens in khesari dal? There is a toxin boa. All right. And this toxin boa was responsible for what? First, I'm just going to put the names over here. Neurolathyrism. Okay. So the toxin is boa in Khesari dal. Khesari dal resembles what? Arhar dal. I'll show you the photo. Okay, so this is Khesari dal. Alright, now although Khesari dal has now been banned, okay, still it is being grown illegally. This has the toxin boa, okay, and the question can come is that Khesari dal resembles which dal, everybody? Khesari dal resembles Arhar dal, okay, it resembles what? Arhar dal. Alright, so it is being, Khesari dal is mixed with Arhar dal, and this toxin boa leads to what? What is known as neurolethyrism. Neurolethyrism is nothing but spastic paralysis of lower limb. Can you see this? Spastic paralysis of lower limb, okay, spastic paralysis of lower limbs you can see, not flaccid, spastic paralysis. Plus 30% of dal is consumed over 6 months, this thing can occur, and the person can present with a latent stage, okay, or a dormant stage, then 1 stick stage, okay, this is a 2 stick stage where he has to carry 2 sticks, okay, or even a crawling stage. Now, is it happening throughout India? Like mostly, no. It is in certain endemic areas, okay, like UP and all these places where they are eating Khesari dal is being consumed, there you can see this. Alright, this is very, very important. So you can have a latent stage, even you can have in fact a no stick stage, okay, then 1 stick, 2 stick, crawling stage. Mostly seen in UP, Madhya Pradesh, okay, Maharashtra, West Bengal, okay, West Bengal, Chhattisgarh, okay, these places you will see this, okay, Chhattisgarh. Now remember one thing, if a question comes that a person hailing from UP presents with lethyrism or something like that, spastic paralysis of lower limb, okay, his diet has been something, he's been consuming some dal. What is it? Neurolethyrism. Okay. Now we had banned the crop. Okay. So legal ban hua tha crop. Okay, ban of the crop was done. All right. Other than that, what was used? Vitamin C as prophylaxis. Okay, vitamin C as prophylaxis. Then to steeping method as well as which method? Parboiling method. Okay, parboiling method. Remember one more thing, osteolethyrism is not reported in humans. Okay, osteolethyrism only in animals. Okay, so this could also come as your MCQs. Okay, so the first one over here, Khesari dal has toxin boa, beta oxalyl aminoalanine. Okay, next one is contamination of mustard oil with Argemone mexicana oil. What is the toxin in that? Sanguinarine. Okay, this leads to what? Epidemic ascites, epidemic dropsy. Sorry, please remember food adulteration aata hai exam mein. Okay, let's see this over here. See, epidemic dropsy. Can you see this? So what happens over here? We are contaminating, contamination of which oil? People are contaminating mustard oil. Okay, with which oil? Mustard oil with Argemone mexicana oil. Okay, Argemone mexicana oil. In this, the toxin present is sanguinarine. Now, if you've seen mustard fields are yellow, just close to that, you can see some weeds of Argemone mexicana grow, okay, and they contain the toxin sanguinarine. Now, what happens in this? Can you see? This is what? Non-inflammatory bilateral edema, okay, non-inflammatory, very, very important, okay, bilateral non-inflammatory edema. It can also lead to congestive heart failure and death. So, I've written it for you, leads to bilateral non-inflammatory bipedal edema, congestive heart failure, death. It occurs due to inhibition of pyruvic acid oxidation, which accumulates in the blood. Plus, once they asked you this flower, so remember this is the just beautiful looking flower is actually like a weed, okay, Argemone mexicana flower from which Argemone oil is being derived, okay. So that is what is epidemic dropsy. Then this one is endemic ascites, okay. This happens due to there is Crotalaria or Junjunia seeds which contain the toxin, okay. This is what Crotalaria plants or Junjunia seeds, okay, Junjunia seeds. In this, what is the toxin present? The toxin is pyrrolizidine, okay, pyrrolizidine. But what is it contaminating? So let us come back to this list once again. See, food like millets, okay, millets get infested with Crotalaria seeds from which this toxin pyrrolizidine is derived, okay, and this leads to what? Endemic ascites, okay, endemic ascites. Then another one which is very common, groundnut cereal maize, okay, these get infested with storage fungus. What is that storage fungus which infests it? It is Aspergillus flavus, okay, what is it? it? Aspergillus flavus, and this Aspergillus flavus contains the toxin aflatoxins. Okay, so this is known as aflatoxicosis. Okay, then you have another one, sorghum, rye and bajra. They get infested with field fungus. What is that name of field fungus, everybody? So that is Claviceps fusiformis. Okay, Claviceps fusiformis. All right, Claviceps fusiformis. इसमें toxin होता है ergot. So this presents with what? Ergotism. Okay, that is very, very important. All right, so these are certain examples of food adulteration which can come. Also remember, aflatoxicosis can lead to hepatocellular carcinoma. Okay, so food adulteration is an important topic. We cannot mess up with this. Now coming to the last thing for your rapid revision in nutrition is certain nutrition health programs. Okay, so one is ICDS, Integrated Child Development Services Scheme. Okay, but if they ask you what does S stand for, services, and look at this logo. Okay, this was launched in 1975. Now this is under which ministry? I've told you ICDS is under Ministry of Women and Child Development. One of the very, very important questions. Okay, not Ministry of Health and Family Welfare. Who are the beneficiaries? So what are we providing them? A lot of services which you will see in the next slide. But to whom are these services being provided? 0 to 6 years children. Okay, not 0 to 5 years. 15 to 49-year female, non-pregnant, long-lactating, pregnant and lactating mothers, and in certain states, adolescent girls. Particularly, the initiative for adolescent girls under ICDS is known as what? Kishori Shakti Yojana. Okay? All right. Now, what are the benefits? Supplementary nutrition. It's not a replacement feed. Please remember, it's not a replacement feed. It doesn't mean that the child is not supposed to eat at home. No, it's a form of supplementary nutrition. Immunization to the child, we ensure immunization. Non-formal preschool education, okay? Not formal, non-formal. Health checkup, referral services, nutrition, health education, adolescent health, vocational training, okay? So that is about ICDS. Please remember the organization that it is running is in Anganwadi Center. ICDS is running where? In Anganwadi Centers. And we definitely get the question, one Anganwadi Center is for every 400 to 800 population. In which area? Plain areas, okay, and 300 to 800 population. In which area? Hilly areas. And in case there is a mini Anganwadi, 150 to 300. And if there is no Anganwadi center, but if the settlement has up to 40 children, okay, under 6 years, but no Anganwadi center, the Anganwadi center can be set up on demand. And here, who is the main person based? Anganwadi worker. Okay. All right. Now, Pradhan Mantri Poshan Shakti Nirman. In this, like we had studied, it is two things. PM Poshan Shakti, Pradhan Mantri Poshan Shakti. All right. What was this, everybody? This was earlier midday meal. Okay. This was earlier midday meal. And over here, what do you have? You have Poshan Abhiyan. Okay. You have Poshan Abhiyan. So let us just quickly look at both of these. So this is PM Poshan, Pradhan Mantri Poshan Shakti. This was, everybody, earlier midday meal. Now you can see all the children sitting in a circle eating from a common plate. This is under which ministry? So this is under Ministry of Education. Earlier it was launched by Human Resource and Development, but now it is under Ministry of Education. Most important, this provides us 1/3 calorie. Okay, this meal provides 1/3 calorie and half of protein. And why did we have this? To prevent dropouts from school. Okay, to prevent dropouts from school. Dropouts from school. Okay, now parents used to think that at least they are getting food in school. Let us send our children to school. Okay, so now the key points is that now why has the name changed? Because now it includes Bal Vatikas also. Bal Vatikas matlab before primary school. Okay, so Bal Vatikas are also included. Okay, so here I have written it, I think, for you. Yes, before class 1 students, and total beneficiaries are now Bal Vatikas. Bal Vatikas means before class 1, all right, and also class 1 to class 8. primary to upper primary. ठीक है, primary gets 450 kilocalories per day and 12 gram protein. Upper primary is 700 kilocalories and 20 grams. So basically under midday meal, which is now PM Poshan Shakti, we have Bal Vatikas and class 1 to class 8 students. Okay, these are the calories and proteins which is provided. Now this was a PYQ, that what is the food norm? Pulses every day should be included in the diet, 25 to 30 grams, vegetables 65 to 75 grams, and fat 7.5 grams. Now remember, there's a fixed menu, okay, but it is an improvised menu, and in drought affected areas, even during holidays, this meal is being provided. That question can come. So see, the meal provided in midday meal should supply 1/3 of energy and half of protein. It is now Poshan PM. Midday meal is now under Ministry of Education. So remember, it is PM Poshan Shakti. Okay, what is the name of this program now? PM Poshan Shakti. All right. What is the other part? Poshan Abhiyan. It's like a growing tree. Can you see? Prime Minister's overarching scheme for holistic nourishment. Okay, throughout nourishment should be provided under Poshan Abhiyan. Now remember, this is also under Ministry of, like ICDS, Women and Child Development. This can definitely come. And what is the other name for this? The other name for this is National Nutrition Mission. Okay, what is it? National Nutrition Mission. Now this was launched in 2018, guys, but now, of course, it is under Pradhan Mantri Poshan Shakti Nirman. So I just want to tell you that we wanted to reduce stunting in this. Stunting means low height for age. Okay, low height for age by 2% point per year. That means basically this was a program from 2018 to 2022, but it has of course been extended now. Okay, so stunting by 2% point every year, undernutrition and underweight. That means low weight for age. We want to reduce that by 2% point every year. Okay, and low birth weight also by 2% point. But anemia prevalence, whether it's up to 5 years or whether it's among girls and women, by 3% point every year. Okay, so that is PM Poshan Abhiyan. Okay, look at the diagram. This is important. All right. Now for anemia component particularly, we have which strategy? Anemia Mukt Bharat. This is what? 6x6x6 strategy. Okay, and this is under which ministry, everybody? This is under Ministry of Health. And basically for anemia component of under Poshan Abhiyan, it is being supervised by Ministry of Health and Family Welfare. Okay, and under this you can see this logo, 6x6x6 strategy. So we have 6 beneficiaries and 6 interventions. Okay, that is very, very important. So under Anemia Mukt Bharat, what is being provided, guys? Prophylactic iron folic acid administration. Okay, now you all know that for the first 6 months nothing additional iron has to be given from to the baby, because from mother's milk it is sufficient. So here it is, you can remember, after 6 months we are starting for the baby. All right, till 5 years. Okay, so that is very, very important. So 6 to 59 months. All right, then 5 to 9 years, then 10 to 19 years, adolescent boys. Okay, this is boys, this is adolescent age group, and also adolescent girls. Okay, then you have what? Reproductive age females. Okay, reproductive age females. All right, this is what? Reproductive age females. And then you have pregnant and lactating mothers. In reproductive age females, we are mostly covering 20 to 49 years. Okay, now prophylactic iron folic acid is being given over here. So and the important thing is to know the schedule also. Okay, so here it is how much iron is being provided: 20 milligram elemental iron, 100 microgram folic acid. This is being given bi-weekly in the form of a syrup. Okay, 5 to 9 years, it's all 4 and 4, meaning 45 milligram elemental iron, 400 microgram folic acid, and this is being given weekly. Okay, in the form of a pink tablet. Okay, but most important, 10 to 19 years old, it is iron ki neeli goli. Remember, for adolescents it is iron ki neeli goli. तो यहाँ पे कितना देते हैं 60 मिलीग्राम एलिमेंटल आयरन, 500 माइक्रोग्राम फॉलिक एसिड वीकली. ओके, दिस इज बीइंग प्रोवाइडेड थ्रू विफ्स, वीकली आयरन फॉलिक एसिड सप्लीमेंटेशन. Rest you can write over here, red color tablets, okay, 60 milligram and 500 microgram folic acid, 500. But reproductive age females, again weekly, pregnant and lactating mothers, it is given daily. After the first trimester we start, and it should also be given up to 6 months after lactation. Plus इसमें हम लोग deworming कर रहे हैं. Yes, so you can see over here deworming is being done. Prophylactic iron folic acid is being given. Periodic deworming of children, adolescent, pregnant women. So in pregnant women it is ideally done in the second trimester with the full tablet of albendazole. Plus delayed behavior change communication, delayed cord clamping is recommended. Testing of anemia using digital methods and point of care treatment. Also provision of iron fortified, iron and folic acid rich food and addressing non-nutritional causes of anemia. Okay? So remember, this Anemia Mukt Bharat is particularly looking after the anemia component of Poshan Abhiyan. Okay? So these were the food programs, which is very important. Coming to the last one, food logos. This is Food Safety Standard Authority in India. So from this provides us what? National food standards. Okay, national food standards. This is also under Ministry of Health and Family Welfare. The headquarters of FSSAI has also come Delhi. Now this national food standards have been adopted from what? National food standards. Okay, they have been adopted from what? They have been adopted from this Codex Alimentarius, which give us the international food standards. They were framed by WHO and FAO. Headquarter of WHO, Geneva. FAO, याद है खाना खाने के लिए, to eat food. Let's go to Rome. All right, BIS is Bureau of Indian Standards. Bureau of Indian Standards. This is also PYQ. Now see, this is ensuring quality of food products or ensuring quality, okay, ensuring quality above minimum standards. Okay, this ensures what? Quality above minimum standards. See, if we require quality of minimum standards, okay, minimum standard quality, if we require minimum standard quality, now this is being provided to us by what? Minimum standard quality by PFA Act, okay, Prevention of Food Adulteration Act. This ensures minimum standards quality. But if we require quality above minimum standard, BIS mark has to be there. This could be on food products, on jewelry, industrial appliances, all of that thing, okay. All right, now see over here, a person after consuming an allegedly adulterated food product develops, see, bilateral swelling, diarrhea, glaucoma, cardiac failure. So what is it? So this is what? Epidemic dropsy, right? This is an example of epidemic dropsy. Epidemic, mustard oil contamination with argemone oil, and what is the toxin? Sanguinarine. Okay? Food Standards and Safety Authority comes under Ministry of Health and Family Welfare. Okay? That was it for nutrition. I've tried to compile everything in one slide, guys. The most important one to go through. Thank you so much. So hello dear students, welcome back to this rapid revision of social sciences in health, a chapter of definitions where we're going to cover social sciences, family cycle and a lot of other important things, okay? Alright, so what is social sciences? Now basically this is, like I said, a chapter of definition. So we've done this before also. It is scientific examination of human behavior, okay? Looking at human behavior scientifically. So scientific examination of human behavior is what is social sciences, okay? Everything we need to give a look scientifically. So first we'll start with sociology, and a very important part, a very important component, okay, a very important component of social sciences is sociology, which you are going to study. Also psychology. These two things we are going to do in detail, okay? All right, so let us start with the common definitions. So sociology and concepts. First thing is the common definitions which are asked, okay? So what is a society? A group of individuals living together and lead a certain way of life. Okay, a group of individuals living together and leading a certain way of life. That is what is a society. Why do we all have to be part of a society? Because a society always governs our behavior. Okay, governs our behavior. Like if we are not bounded by certain limitations of the society, everybody would start behaving in their own manner. So a group of individuals living together and lead a certain way of life form a society. Okay, it governs or regulates our behavior. Now a society bounded within a geographical boundary. Okay, a society within geographical boundary. Okay, society within geographical boundary. What does this form? A society within geographical boundary is a community. A society residing within a geographical boundary is a community sharing, where individuals are sharing what? Common values and interests. Okay, so whenever you get the definition, just see if they've mentioned society within geographical boundary, that is community. Okay, these are two very, very important definitions. What is the third one? Social structure. What is social structure? It is nothing but pattern of interrelationships among members of a society. Okay, among members of a society. Pattern of interrelationships. How are the people who are residing in a society behaving amongst themselves? Okay, so that is social structure. Socialization. Now, are we born knowing what are the things that we have to follow in a society? No. So socialization is process by which an individual adopts the cultures, customs. Okay, you'll see what is culture and customs also, and becomes part of society. Okay, so what is socialization? It's nothing but a process by which an individual becomes a part of the society. All right, example of socialization I'll give you. Okay, internship training to doctors. Okay, internship training to doctors. Now, what happens in internship training? Why do we get this? Why are we doing this internship? So that we get familiarized with the surroundings. Okay, familiar with hospital surroundings, familiar with hospital culture, and we know how to behave in that. Okay, so that is socialization. Acculturation is very, very important. Okay, this is what? Cultural contact. It's one of the famous PYQs. Okay, cultural contact, or you could also say exchange of cultures. Now, when is this acculturation happening? Cultural contact or exchange of cultures? Obviously, when you get married into another culture, when a country conquers another country, when you go to study. So this is what are expected MCQs. Okay, when does cultural contact occur? It can occur through trade and commerce, industrialization, education, conquest, religion propagation, or marriage. Okay, through any of this cultural contact can. Now see, children going to school, internship training, this is an example of already discussed socialization. Okay, how a person adopts the culture and becomes a part of the society. What is social pathology? Social causes leading to the occurrence of a disease. Social causes leading to what? Social causes are also responsible for the occurrence of a disease. Now, we all know there is a pathogenesis or a mechanism, a biological mechanism because of which a disease can result. But there are social causes also. Like, can you give me some examples of social causes? Like poverty. Poverty can lead to the occurrence of a disease. Okay, unemployment can lead to the occurrence of a disease. Okay, addiction can lead to the occurrence of a disease. All right, any of these things, migration. Okay, people from rural areas are migrating to urban areas, coming in search of work, but they wouldn't get it. Okay, so that could also lead to. So any social cause which is leading to the occurrence of a disease, smoking habits, drinking habits, any of this can lead to the occurrence of a disease. That is what is social pathology. Okay, now what do you mean by customs, everybody? So customs are, any of this definition can comes, established pattern of behavior. Okay, customs are what? Established pattern of behavior. That is what is customs. But what is culture? Culture is learned pattern of behavior. Okay, customs are certain things which are established. Okay, they are established pattern of behavior. Culture is learned pattern of behavior. Now here you should know one thing. Okay, when you talk about customs, they are established patterns. Okay, so that it is divided into two things. Okay, folkways and mores. Now M for more. Okay, so what is this? This is more stringent customs, meaning if you don't follow these customs you might be punished. Example, parda system. Okay, in certain this thing the women have to cover their head. Okay, so if they don't follow it they will be questioned for it. Folkways means less stringent customs. Okay, less stringent customs. Like example, greetings. Okay, greetings, like if some elderly is sitting in your house, you should greet them. If you don't greet them, your father will just point out to you, but you won't be really beaten up or something for it. Okay, so that is what is customs. So let's have a look at some MCQs. This was the first part, guys. Sociology is study of human relationship and human behavior both. Okay, did we mention the definition of sociology? Okay, here let me write it. Okay, what is sociology? It is the study of human relationships. Okay, study of human relationships and human behavior both. Okay, not just one thing. Okay, it's the study of human relationships and human behavior both. All right, next, an organized group of people with social relationships, society. If they are residing in a defined geographical boundary, it will become community. What is social pathology? Study of social problems which cause disease in population. What is acculturation, guys? Triage, cultural change, attitude, belief. So it's cultural contact. Okay, pattern of interrelationship, like how is the behavior of people among members in a society. So that is what is known as pattern of interrelationship is social structure. Okay, all right. Acculturation means cultural contact. ठीक है, cultural history को पढ़ने को क्या बोलते हैं? Social anthropology. Okay. All right, exchange of ideas is nothing but health communication. Okay, this is what exchange of ideas. Chalo next. In psychology, what do you understand by opinions? What are beliefs and what is attitude? Okay, to understand a person. So always remember, opinion is something which is very temporary. Okay, opinion is temporary and it is subjective in nature. Okay, it is subjective in nature. Like, what is your opinion? How will be the next exams? So you say it's going to be easy. You go to get today to some gathering where your friends come, and then the discussion of next exam happens, and then you come back tomorrow and tell me, ma'am, I think it's going to be tough. So opinion means something which is temporary, subjective in nature. But what is belief, guys? Belief is something which is permanent. This is also subjective in nature. Subjective means it depends on what you think. Okay, that is what is belief. All right, and centered around the belief is attitude. Okay, attitude is acquired characteristics of an individual, more or less permanent ways of behaving. It is organization of beliefs. Okay, it's centered around the belief. How would one respond in a desired manner? So remember, attitude out of opinion, belief and attitude. Attitude is something which is objective in nature. It is independent of what the person thinks. Okay, so opinion is something temporary and opinion is subjective in nature. What about belief? Belief is something permanent, that is also subjective in nature, and revolving around your belief is your attitude, how you're going to behave. Okay, so that is more or less permanent way of behaving. Custom way of doing things is habits. Okay, and what is emotions? Emotions are feelings. Okay, a question comes, which is the most common emotion experienced, everybody? So which is the most common emotion experienced, guys? Please remember, it is fear. Fear of losing, fear of losing your power, fear of failing in exams. That makes you put in extra effort. Okay, what is this definition? Any relatively permanent change in behavior that occurs as a result of learning or occurs as a result of practice or experience. This is learning. And please remember, there are three types of learning. Okay, a lot of PYQs come from this. It is nothing but cognitive, affective and psychomotor learning. Okay, so cognitive learning is based on our knowledge. Affective again is attitude. but psychomotor is something which derives on or which is based on development of skills. Okay, psychomotor learning is based on development of skills. Very, very important. Okay, so here psychomotor learning may remember example, teaching an intern knee reflex demonstration. Okay, teaching an intern knee reflex demonstration. That is what is an example of psychomotor learning. Attitude is affective learning is how you're going to behave. Okay, all right. Now there's a question which comes, which out of the following are temporary groups and which out of the following are permanent groups? So remember, temporary groups may you have a crowd, mob and herd. Okay, what is crowd? A group of individuals who've come together by a common interest. That means they've gathered together out of curiosity. Like we all are sitting here, an accident happens outside, and out of curiosity, all of us go out to see what has happened. That is crowd, okay? Mob is an emotionally agitated crowd with a leader. Please remember, mob as a leader and is emotionally agitated. Like in the emergency, a patient dies, okay? The relative of the patient gets emotionally agitated and also affects or influences the other people there. That is what is mob and comes to argue with the doctor. Herd is a crowd with a leader, but members follow the group without any questions. Okay, so example of herd, it's not very emotionally related or something, but in herd, like example is tourist guide. Okay, if we are following a tourist guide and if the tourist guide says this is a Taj Mahal, we'll say okay. All right, so it's also a crowd, it's a temporary gathering and we are following a leader without any questions. Okay, example religious leaders as well. But permanent groups, just know the name: band, village, towns and cities. These are all permanent groups. Just know what is band. Most elementary community of a few families living together, they have organized itself and they follow a pattern of life. Example, gypsies in India. So remember what are the temporary groups and remember what are the permanent groups. Okay, they can come in your exams. So see which of the following is not a temporary group. Like I said, crowd, mob, herd. ठीक है, CMH. Okay, whatever way you want to remember. Band is something which is permanent. Okay, band is something which is permanent. Okay, there are certain theories of sociology. I just want you to know 3 theories. Okay, these can come as PY. These are actually PYQ. There's a Marxist theory which says put profit ahead of health. Like tobacco consumption has not been banned completely because it will lead to loss of revenue. It's like the government is increasing the cost of cigarettes, but is it banning it completely? No, because a lot of revenue is generated from alcohol sale or tobacco sale. So when we put profit ahead of health, that is Marxist theory. Okay, there's one theory known as Parsonian theory, like social constraints like poverty, migration and industrialization. Like TB is due to poverty leading to overcrowding. Okay, that is what is Parsonian. More important than the organism or something, it is due to the social conditions which can affect TB. Macknion theory of TB is a repeated PYQ, guys. Now Macknion said, Macknion actually said that TB has reduced not due to, improvement in diagnostic and treatment conditions, but due to change in socio-environmental conditions. Okay, so Macknion said that TB has not reduced due to, improvement in diagnostic and treatment modalities. Improvement in diagnostic and treatment modalities. No, it's not because of that TB has reduced, but because due to changes in socio-environmental conditions that TB has reduced. Okay, so just remember Marxist and Macknion. They can definitely come in your exams. Okay, so that was a quick revision of the first part, all the important sociology definitions, okay, which can come in your exams. Now let's quickly do family. Okay, so what is family? You all know family is a group of individuals, okay, related by blood / law, okay, living together and eating from a common kitchen. So this is a very basic definition: group of individuals related by blood or by law, living together, eating from a common kitchen. Blood means blood relation, your siblings. Law means it is like how our parents related by marriage, okay, or by adoption. Okay, adoption is also an example of law. Now there are 2 things: family of origin. Family of origin is where one is born, and family of procreation is the family one creates, okay, after marriage. So where you are born is family of origin. The family that you create after marriage is procreation. Okay, these are some examples. Okay, one more thing, who's the head of the family? Please remember, head of the family is the major decision maker. Okay, who's the head of the family? The major decision maker, who's going to make all the major decisions of the family. Where do we have to buy a property? Where should money be invested? Where should the children go to school? How many children should the couples in the family have? Okay, it is not dependent. It's not necessary that head of the family is the senior most. Okay, but in a joint family, you will see that many times the senior most only becomes the head of the family. Okay, it can be male or female. Not necessary that head of the family is the most educated. Okay, or again, it is not necessary that the head of the family is the earning member. Okay, please remember this. Now there's another thing, family cycle. What is family cycle? It has different stages. Formation is marriage to birth of first child, extension birth of first child to birth of last child, complete extension birth of last child till the first child leaves home, contraction first child leaves home till the last child leaves home, complete contraction last child leaves home till the first spouse dies, and dissolution is first spouse dies till the death of survivor. It has come many times, family cycle. Okay? Now what is types of family, everybody? So let's start with nuclear family. We'll just be revising a few important ones. Nuclear family is what? Nuclear family is an elementary family actually. Okay, so what is it? A married couple with or without, single married couple with or without dependent children. Nuclear family is just one couple with or without their children. Okay, new family, that means a newly married couple is also nuclear family if they are not putting up with the in-laws. New family, please remember, is a nuclear family less than 10 years duration. Never say it's a joint family. No, it's a nuclear family less than 10 years duration. What is a joint family? It consists of two or more than two married couples and the children living together in the same household. Features it, all of the family members are related to each other by blood. All of the family or all the males of the family. Okay, all males of the family are related by blood. Okay, they are the brothers, and the females are either their wives, sisters or daughters. All property is held in common. There's always a common purse, and you know there's always a common purse, like whatever money everybody is earning is going to go into one common purse, and the senior male member of the family holds the authority. He becomes the major decision maker. That happens in the joint family. Okay, automatically the senior most assumes the role. 3-generation family, you all know, is where representatives of 3 generation are present. Okay, what does that mean? Grandparents, parents and their children. Okay, so representatives of 3 generation. It's actually a type of joint family only. It's a type of joint family only. Representatives of 3 generation are present. What is a broken family? Very, very important. So a broken family is a family where either of the parent is dead, all right, or the couple is divorced / separated. What is a problem family? A family which lags behind rest of the community. What do I mean by this? It means that the basic physiological needs, okay, the love, security, physiological needs are not being provided by parents. Okay, what is communal family? A family where there is division of labor. Division of labor means the roles and responsibilities of the members have been distributed. Okay, so these are very, very important definitions. Broken and problem definitely come. There's also a dysfunctional family, a family where conflict, misbehavior and even abuse on the part of an individual member of the families occur continuously. and the other members accommodate to such actions. Okay, there's a lot of verbal abuse, domestic abuse, all those things, a lot of violence. Rest of the members are fine with it. So this was the definition of family, types of family, family cycle. Okay, socio-economic status scales, please remember, urban mein you have to study modified Kuppuswamy, rural mein we have Uday Parikh, BG Prasad, and the rest names you can see. Now what is this Kuppuswamy scale? Most important modified Kuppuswamy scale. It is a scale to assess the socio-economic status in urban area, and it is based on 3 components if you remember. Education of whom? Education of head of family. Okay, that's important. Education of head of family. Occupation of head of family. I've told you who's head of family. And please remember, it is total family income. Never say per capita income. Per capita income was before. Now it is total family income. And based on this, you can see education of head of family, the scoring is from 1 to 7. Okay, 1 is literate and 7 is professional honors. You don't need to memorize this, but at least you need to know education mein how much is the scoring, from 1 to 7. Occupation mein how much is the scoring, from 1 to 10. Don't go like 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. No. After 6, straight away it is 10. Okay, and when you will see total family income, now I've not put a slab over here because it is from 1 to 12 and it keeps on modifying every year based on the different income slabs. Okay, but the minimum scoring in total family is 1 and maximum is 12. So in education it is what? 1 to 7. In occupation, education is 1 to 7. Occupation is 1 to 10 and family income everybody is 1 to 12. So in Kuppuswamy guys, what is the minimum score if you see? 111, so 3. And what is the maximum score if you see, if you calculate this? 29. So please remember, Kuppuswamy scale ranges from 3 to 29. Okay, this is a PY. And below 5 it is lower, upper lower, lower middle, upper class. Okay, so remember upper class and below 5. Below 5 is lower, but upper class is 26 to 29. But minimum score that this thing will get in Kuppuswamy is 3 and maximum score is 29. Okay. Alright. Uday Parikh scale is based on 9 parameters. Okay, now Uday Parikh is for rural areas. You just have to know that it is independent of income. Okay, you can see over here, income is not there. Caste, occupation, education, land, social participation, family members, house, farm power, material. Okay, but BG Prasad, P for Paisa. So BG Prasad is dependent on what? Per capita income. Okay, so these are the socio-economic status scales which you must know. One criteria for below poverty line, which family is below poverty line? Okay, according to, we have 2 committees, Tendulkar and Srivastava committee. Okay, so you can look over here that if the per capita calorie intake in rural areas is less than 2400 kilocalories per day and if the per capita income is less than 27 INR per day. Per capita means whatever is the total family income divided by the number of family members. So based on what is known as Tendulkar committee, this is according to the Tendulkar committee, that if per capita calorie intake in rural areas is below 2400 kilocalories per day, in urban areas below 2100 kilocalories per day, and the per capita income in rural areas is below 27 INR per day and urban areas it is 33 INR per day, the person belongs to below poverty line. Okay, so there's another criteria for assessing below poverty line. This is based on which committee? Ranga Rajan committee. Okay, according to Ranga Rajan committee, if the per capita income is less than 32 INR per day in rural area and less than 47 INR per day in urban area, belongs to below poverty line. But what does World Bank said? Okay, please remember, as per WHO, if per capita income, this is according to World Bank, is below 2.15 US dollar. This was earlier 1.9 US dollars. But now if per capita income, I told you what is per capita income. Remember, it is whatever is the total family income, okay, divided by the total family members. Okay, divide, that gives per capita. So if the per capita income of any family is below 2.15 US dollars per day, okay, this is extreme poverty. Okay, what is this? This is extreme poverty. This is the updated definition of poverty line. points. Okay. Last but not the least, a few definitions come from health economics, like what is gross national income, income which is generated from within the country as well as that received from abroad. And you all know this is an indicator of what? This is an indicator of, or it is an indicator of objective component of well-being. You remember, this is an indicator of objective component of standard of living, okay, which we have studied. All right. Gross domestic product is income which is only generated within a country, domestic, so only within a country. These two come as PYQ. Net national product, you can just read GNP minus capital we consume. Remember, GNI or GNP is income generated within the country as well as the one that we receive from outside. And GDP is only one which is generated within the country. All right. Net domestic product, GDP minus value of depreciation on fixed assets. Somebody might ask you what is purchasing power parity. So number of units of a country's currency required to buy the same amount of goods and services in domestic market. Like if something is brought for $1 in USA, how much will it be brought in India for? These are different rights. We can just go through: right to equality, freedom of speech and expression, right against exploitation, right to freedom of practice, propagation of religion, right of minorities, right to poverty, right to constitution. Like they can ask you which of the following is not a right of an individual. Okay. All right. So that was a quick revision. Let's have a quick look at some questions. Family which lags behind rest of the community is problem family, right? Broken, where the couple is divorced, separated, or any of the parent is dead. Elementary is nuclear, and communal is where there's division of labor. Nuclear family, we all know, husband, wife, and dependent children. A family where all of its members play a part in its management. This is what? A communal family, right? Like a community. The following is true about new family. I told you it's a all nuclear family less than 10 years duration. Income generated within a country is known as, now see, only within a country, GDP. But that generated within a country and from abroad, GNP. Upper class in Kuppuswamy, I told you scoring is between 3 to 29. Upper class you have to know 26 to 29. And lower class was below 5. Thank you so much.